Hi everyone. This is my friend Sarah,
Hi.
and we will be interviewing her about a heart condition that she lives with. She will be giving us a small insight into what her experience has been. So Sarah, first I'll start off with if you could let us know how you were diagnosed.
Well, I had gotten really sick and I was in the hospital, and and it turned out that I needed heart surgery to replace a bad valve.
Okay, and what is your heart condition called?
It was my tricuspid valve that needed to be replaced, and I also had an enlarged heart.
Okay, and did they say what caused this heart condition?
So I had bacteremia, which is bacteria in the blood, and it was caused by, I believe, pneumonia that had gotten so bad that, other bacteria in my body was just unfortunately kind of able to run rampant, and it caused a vegetation on my heart valve, and it needed to be replaced.
Wow. What are some of the symptoms that that you were experiencing prior to going to the doctor and finding out there was a problem with your heart?
Well, I had intense fever. I was shaking horribly. I was throwing up a lot. I thought it was the flu, but it wasn't. Eventually, I was actually coughing up blood. But it was different because it didn't look like oxygenated blood. It was like purple.
Wow.
And so, yeah, I guess I was having issues with blood getting into my lungs.
Wow. How long were you in the hospital?
For 3 months, 2.5 months, I was in an induced coma. And for 2 weeks, they were making sure that I was stable enough to go home so I could get stronger in order to have my heart surgery.
And how did your heart surgery go?
It went well. I was a little bit afraid of the procedure, but it couldn't be any worse than what I had already gone through, so I was ready for it.
Wow. What medications have you been prescribed?
I just take 325 milligrams of aspirin because the tricuspid valve is on a low pressure, it's a low pressure system. So I'm very fortunate to not have to take Coumadin or some of the other harsher blood thinners.
And how has your daily life been affected?
I'm just more concerned with my heart and health, and so I just try to stay active.
Okay, and then, and on behalf of my group, we just thank you for your insight and sharing with us your experience. Um, yeah, you're just a miracle to be sitting here, so thank you.
Thank you so much. Thanks for having me.
Thank you.